what's called a standing flexion test, and this is a test that's used to screen for possible what we call iliosacral dysfunction. So in other words, how the ilium or innominate bone, which would be the more correct term, because the innominate is the ilium, the ischium, and the pubis all fused together by the time you're an adult. If there's some dysfunction in the pelvis at the sacroiliac joint or the pubic joint, pubic symphysis joint, related to innominate motion. So the test for that is we're first going to find the posterior superior iliac spine, so the PSIS. We want to be right behind the patient at the level of the PSIS. So we did this before. Remember, you find the iliac crest and the posterior iliac spine. You're going to come down till you get right to that ledge, and then you're going to have the patient bend forward as if they're going to touch their toes. And we look to see if either PSIS sort of rides high, come back. And there was a little bit on the right, so I would say positive on the right, but it wasn't glaringly obvious, so it's not sort of drawing me more strongly than any of the other things we've seen. And then we'll follow that up with what's called a seated flexion test. So if you don't mind sitting and facing the window again there. Through. So this is essentially the same test, but seated in. The idea here is that if this test is positive, it's more suggestive of a sacroiliac versus an iliosacral issue. So problem with how the sacrum's moving, and that can be an issue with how the sacrum's moving relative to the sacroiliac joint, or occasionally it can be an issue with how the sacrum is moving relative to the lumbosacral joint. So again, making sure our eyes are at the level of the PSIS, identifying that inferior aspect of the PSIS on either side, and having the patient put your hands between your legs there and just bend forward. Good, and come back up. And that was nice and smooth and symmetric, and one side didn't really ride high, so I would say basically an equivocal or a negative seated flexion test.